Dear students, welcome back. In the previous session, we have seen the contents of the superficial fascia. Again, we'll go back to the layers of the abdominal wall. The first layer is the skin and then superficial fascia. This superficial fascia is having outer layer and the deep membranous layer. The outer layer is fatty layer. And also we have seen the contents which are passing in between these two layers. Okay, and the next layer is the muscles of the anterior abdominal wall. In between the superficial fascia and the muscles, in the abdominal wall, in the anterior abdominal wall, there is no deep fascia present. Okay, and then the muscles become the third layer of the anterior abdominal wall. Okay. Now we will see the muscles of anterior abdominal wall. So here the anterior abdominal wall includes some lateral part also, the muscles which originating from the lateral side also. So we are going to discuss about the muscles of the anterolateral abdominal wall. Okay. So this anterolateral abdominal wall is mainly made up of with muscles. So this one is the anterior and this one is the lateral part of the abdominal wall is mainly made up of with muscles. On either side of the midline, it is having four large muscles and two small muscles. Okay. The four large muscles are, one is the external oblique muscle. So the first muscle is the external oblique muscle. We can see this one anterolateral side. So the first one is the external oblique muscle, and the next layer here you can see this one is the internal oblique muscle, and next to this internal oblique muscle you will have this transverse muscle, and the muscle which is present on the anterior aspect which runs vertically on either side of the linea alba, that is the rectus abdominis muscle. Okay, so these are the four large muscles. On this side also we will have this rectus abdominis. This rectus abdominis is removed on the right side. So here you can see on the left side, this one is the rectus abdominis muscle, and the two small muscles are the cremaster muscle and the pyramidalis muscle. So normally it is present at the lower abdominal region. So pyramidalis, which is present on the lower aspect of this rectus abdominis muscle. So in front of the rectus abdominis muscle, it is having a pyramidalis muscle, and some extension from the internal oblique muscle which is extending into the scrotum. The another muscle, that is the cremaster muscle, is present. So the two small muscles are the pyramidalis muscle and the cremaster muscle, and the large muscles are, and these large muscles are flat muscles, and these muscles are present anterolateral aspect of the abdominal wall, and each of them, so each muscle extends, okay, and ends, each muscle ends into an extensive aponeurosis that reaches the midline. The white part is nothing but the aponeurosis of each muscle. Okay, so this will end up as an aponeurosis that will reach to the midline. At the midline, the aponeurosis of both right side and left side will decussate. That means these two fibers will intercross. So they will cross each other to form a median band called as linea alba. The linea alba is formed due to this decussation of this aponeurosis of right side and left side flat muscles. Okay. Yes. So these are all about the muscles which are present on the anterior or anterolateral aspect of the abdominal wall. And this rectus abdominis, which runs vertically on either side of the linea alba, is enclosed in a sheath which is formed by the aponeurosis of this flat muscles called as rectus sheath. So that rectus sheath we'll discuss later. Just in this introduction part you have to know it. So as a whole, how many muscles are present in the anterior abdominal wall or anterolateral abdominal wall? It consists of 4 large flat muscles and 2 small muscles. The 4 large flat muscles are the external oblique, internal oblique, and the transverse abdominis, and finally the rectus abdominis, and this rectus abdominis is covered with a sheath. Okay, and the smaller muscles are the cremaster muscle and the pyramidalis muscle. Now we are going to see each muscle in detail, its origin, insertion, nerve supply, and its action. The first muscle now we are going to see is the external oblique muscle. Okay, so this external oblique muscle, how it is getting originating and how the fibers are running and where it is getting inserted and what is its nerve supply. And then so here we can see actions of all these muscles together finally. Okay, now we'll see the external oblique muscle origin. This muscle arises by 8 fleshy slips from the outer surfaces middle of the shaft of the lower 8 ribs. So here you can see the lower 8 ribs from 5th, 6th, 7th, 8th, 9th, 10th, 11th and 12th. From 5th rib to 12th rib, it is the fibers are getting originating, that is it is having 8 fleshy slips from the outer surfaces and middle of the shaft of the lower 8 ribs. How the fibers are? These fibers run downwards, forwards and medially. Run downwards, forwards and medially. So if you can see this fibers, how these fibers are moving means, if you want to put your hand in your side pocket, then how your hand will move, in the same way these fibers are also moving. So how these fibers run downwards, forwards and medially. Okay, so this is the origin and how these fibers will move. Next, coming to the insertion. So this most of the fibers of the muscle end into a broad aponeurosis. So here the green part you can see, this one is the aponeurosis part. So this one is the aponeurosis, through which they are inserted from above downwards. So they are getting inserted from above downwards into the xiphoid process. So here you'll find the xiphoid process, and then linea alba, okay, pubic symphysis, okay, and then the pubic crest and the pectineal line of the pubis. Okay, and the lower fibers of the muscle. So here you can see the lower fibers of the muscle are inserted directly into the anterior 2/3 of the outer lip of the iliac crest. So on the hip bone you'll have the iliac crest. So on the anterior 2/3 of the outer lip of the iliac crest, the lower fibers are getting inserted. Okay, so this is the insertion of this fibers. So if you want to know its course and direction, so the upper 2/3 of the muscle runs downwards, forwards and medially. Upper 2/3 of the muscle runs downwards, forwards and medially and becomes aponeurotic at a line extending from the tip of the 9th costal cartilage along the semilunaris, as far as the level of the umbilicus, and from there to the anterior superior iliac spine. And the lower 1/3 fibers passes vertically downwards into the insertion, almost vertically downwards to its insertion. Okay, so this is the course and direction of this external oblique muscle. And the nerve supply for this external oblique muscle is the lower 6 thoracic nerves. Lower 6 thoracic nerves, that is from T7 to T12. So this is about the origin, course and direction and insertion and the nerve supply of this external oblique muscle. Normally this external oblique muscle helps in the movements of trunk, that is lateral flexion of same side is done by this external oblique muscle, one-sided oblique muscle. So a rotation of the trunk is produced by the combined action of the external oblique with that of the opposite internal oblique muscles. So there is a combination of muscles which causes some kind of its action. So we are going to see the actions of all these muscles at last. Okay. Now we will see the internal oblique muscle. Yes, the internal oblique muscle is getting originated from the lateral 2/3 of the inguinal ligament. So it is getting originating from the lateral 2/3 of the inguinal ligament. This one is the inguinal ligament here. So it is getting originating from the lateral 2/3 of the inguinal ligament and anterior 2/3. So here you can see this anterior 2/3 of the intermediate area of the iliac crest. Okay, so for insertion of this external oblique, it is getting inserted on the outer lip of the anterior 2/3. Here the internal oblique muscles are getting originating from the intermediate area of the iliac crest, and also it is getting originating from the thoracolumbar fascia. So these are the three origins of this internal oblique muscle. One is the lateral 2/3 of the inguinal ligament and intermediate area of the anterior 2/3 of the iliac crest and the thoracolumbar fascia. So now we will see how these fibers will run. That means the direction of the fibers. Okay, how this direction of fibers of this internal oblique muscles. So the fibers from the lumbar fascia. Okay, the fibers from the lumbar fascia run vertically upwards and insert into the lower borders of the 10th, 11th and 12th ribs. 10th, 11th and 12th ribs. Okay. And fibers from near the anterior superior iliac spine run transversely medially. So as a whole we can say these fibers will run upwards, forwards and medially. Upwards, forwards and medially, which are crossing the fibers of the external oblique muscles at right angles. So the external oblique muscles will run like this, and the internal oblique muscles will run upwards, forwards and medially, which are crossing the fibers of the external oblique muscle at right angles. If you can see how these muscles are crossing with this external oblique is at right angles. Okay, now and this now the insertion of this muscles or the uppermost fibers are inserted directly into the lower 3 or 4 ribs and their cartilages. So lower 4 ribs. So here you can see 9th, 10th, 11th and 12th, lower 4 ribs and their cartilages. The greater part of the muscle ends in an aponeurosis through which it is inserted into the 7th, 8th and 9th costal cartilages and also to the xiphoid process, and then the linea alba and the pubic crest and the pectineal line of the pubis. Okay, so this is the attachment of this aponeurosis. Okay, again we will see this insertion. The uppermost fibers are inserted directly into the lower 3 or 4 ribs and their cartilages, that is from 9th, 10th, 11th and 12th, this is 4, and their costal cartilages, and the greater part of the muscle ends into an aponeurosis through which it is inserted into the 7th, 8th and 9th costal cartilages, and then to the xiphoid process, and then the linea alba and the pubic crest, this one pubic crest, and the pectineal line of the pubis. Okay, and this muscle does not extend beyond the costal margin, and this muscle is getting supplied by the lower 6 thoracic nerves and also the first lumbar nerve. So the first lumbar nerve also supplying to this internal oblique muscle. Okay, now we will see the another muscle, that is the transverse abdominis muscle. Here comes the transverse abdominis muscle. This transverse abdominis muscle is originating from, here you can see almost all, it is having some interesting origin here for this transverse abdominis muscle. The muscle has a fleshy origin from the lateral 1/3 of the inguinal ligament. Here lateral 1/3 of the inguinal ligament and anterior 2/3 of the inner lip of the iliac crest. So for the anterior 2/3 of the outer lip, it is getting inserted by the external oblique muscle. On the intermediate part of this anterior 2/3 of the iliac crest gives origin to the what you called as this internal oblique muscle, and this anterior 2/3 of the inner lip of the iliac crest is giving origin to this transverse abdominis muscle, and this one is also getting originating from the thoracolumbar fascia, and some of the fibers are getting originating from the inner surfaces of the lower 6 costal cartilages. So this is about the origin. In some parts, this thoracolumbar fascia is considered as the vertebral part of this transverse abdominis muscle. Okay, because this thoracolumbar fascia is getting attached to the vertebrae. For that reason, this thoracolumbar fascia is called as the vertebral part origin of the transverse abdominis muscle, and the fibers which are originating from the ribs are called as costal part of the transverse abdominis, and the fibers which are getting originating from this iliac crest, and these are called as the pelvic part of the transverse abdominis muscles. So the fibers which are getting originating from 4 regions, one is the lateral 1/3 of the inguinal ligament, and then the anterior 2/3 of the inner lip of the iliac crest and the thoracolumbar fascia, and then the inner surfaces of the lower 6 costal cartilages, and the fibers are directed horizontally forwards. The fibers are directed horizontally forwards, and these fibers end in a broad aponeurosis which is going to inserted in the xiphoid process, and then again the linea alba, again it come to the pubic crest, okay, and then the pectineal line of the pubis. Okay, these are the insertion of this aponeurosis. So up to this red part, this is the muscular part, and remaining thing is the aponeurosis part. Okay, so this is the origin and insertion of the transverse abdominis muscle, and the nerve supply is also by the lower 6 thoracic nerves and the first lumbar nerve.